Alright, so moving on with our obstetric classes, we'll get to look at a lot of concepts like their names and all. So the next one which we are looking at is what is known as the Pyometra. So what do you mean by Pyometra? Right? So to my best understanding, anytime you hear pyo simply means there's like pores, it's pores formation around the region. Okay. So Pyometra, first of all, we say that is a potentially life-threatening infection of the uterus. Okay, it's most commonly seen in dogs, but rarely it could occur in females. Right? So there's accumulation of pus within the uterine cavity. So it's usually triggered by what? Hormonal changes and bacterial invasion. Right? So there's infection of the uterus. So what causes it mostly is hormonal shift. Okay, so this creates an ideal environment for bacteria to now grow, especially Escherichia coli. The cervix may be open or closed. So open Pyometra allows pus to drain. Okay, while closed one, it's like the whole infection is being trapped back. You understand? So symptoms is vaginal discharge if it is open. All right. There's lethargy, there's vomiting, there's loss of appetite, there's increased thirst and urination, there's abdominal swelling or pain, there's also fever. Okay, in severe cases, you have a bloodstream infection, kidney failure, or a ruptured urethra. So diagnosis and treatment is ultrasound or x-rays will help you to dictate if there's like pus in the uterus. Blood tests to check if there's infections or organ functions. I also check, if the organ function is being maintained. Emergency surgeries. Okay, this is diagnosis and treatment. Okay. So emergency surgeries are the treatment. Antibiotics, if you are dealing, of course you'll be dealing with infections. Then IV fluid, where you're trying to resuscitate the patient.